you, Mr. Zients. We'll do great if our answers aren't so long and we don't filibuster here in the House. So I want to run through a handful of things. I think they're going to bring me a PowerPoint in a second here. Oh wow, that's fast. Thanks. So let's put aside the fact that we're using different 10-year windows to get from the $4 trillion claim to the $5 trillion claim. This stuff's confusing enough.
Right.
Let's just go to the $4 trillion claim, which is what the budget documents make, and because there's a difference in 10-year windows, and I think we would all probably agree on that. So you're saying that the policy changes in this budget reduce the deficit by $4 trillion, correct?
Right.
So bring up figure 2. Oh, there it is. Let's walk through that. Using your numbers. These are not CBO numbers. These are OMB numbers. So to make this $4 trillion claim stick, that this budget does this, the top bar, the blue bar, claims credit for the Budget Control Act, $2.3 trillion. This is a law that was already passed.
Right.
I don't know how one can claim that this budget achieves these things when this is something Congress already passed. And I would add to that, Congress passed this over the President's initial objections. He wanted a clean debt limit increase, then he wanted a tax increase of the debt limit, and only because of this House majority did we get the BCA. So let's take away that claim because that's not in your budget. You can't claim you're achieving this when it's a law that we already passed. So now we're down to the war gimmick. People call this OCO. The war gimmick is let's claim savings on spending that's never going to be requested and never going to be spent, and all of a sudden claim that that's going to save us $850 billion. I don't know what part of the private sector you come from, but if we're saying we're saving money that we were never going to request and never going to spend, I don't know how you can say you're saving money. Now you're down to the doc fix. Nobody wants these doctors to get cut. Nobody wants to see this 27% cut occur. But we can't just assume it away. It's here. It's happening. It's in law. It happens at the end of the month. So we're just assuming that they're not going to get cut, and that's, $430 billion in your numbers. And then let's take off the interest savings that you're attributing to all these claims, and here's what we're left with. We're left with a budget that has only $400 billion in deficit reduction over a 10-year window. If you strip out these accounting tricks, and these budget gimmicks, it's a 10-year budget that spends $47 trillion with a net deficit reduction of $400 billion. So I just don't understand how you can claim anything other than this. Let's go to figure number 1. Let me ask you this. How much does the debt increase under your budget?
Can I respond to
Sure.
the run you just did? Because if you keep building on top of it, it's going to be difficult for me to
Okay,
organize my
let's go
thoughts.
back to figure 2. And
Please, that would be
you bet, my pleasure.
Much more helpful. First of all, I think we all agree that the $2.3 trillion, it's hard to read from here, came from the BCA. And we've been talking consistently about a minimum of $4 trillion of deficit reduction. This reminds me of a marathon and when you start the race. We started the race months ago. So taking credit in this budget for the $2 trillion that we've worked together to achieve, I think makes a lot of sense. Second, on OCO. OCO, very importantly, closes the back door.
Can I get you there then? Then
Right.
why don't you count the stimulus spending and the 24% increase in domestic spending?
So, I'm sorry?
I mean, if you're going to count things that happened in the past, why do you only count the things that work to your benefit, and why don't you
The stimulus
count things
is
that don't work
accounted
to your
for
benefit?
as part of the budgets of the years.
It's not in the numbers.
So the BCA this summer, that counts towards the $4 trillion deficit reduction we've been talking about all along. Secondly, on OCO, very importantly, we are closing the back door to spending by capping OCO. CBO scores it as savings, and it's this president's policies that's led to drawdown, for getting our troops out of Iraq and drawdown in Afghanistan. I don't know exactly how you're cutting the chart here, but somehow you've left off $1.5 trillion of revenue that needs to be raised, revenue that's part of balanced deficit reduction.
So
I don't know where that is, but the president's
that's where you
budget
get,
proposes $1.5 trillion.
because this is just the spending side of the ledger.
Okay, sorry. And then on the spending side, again, I'm not sure how you're cutting it, but there are $360 billion of mandatory savings from health care, and there's another $270 billion of net savings from other mandatory programs. I mentioned some of them, PBGC, the federal retirement, the agricultural programs. So there's further savings there. And then on top of all that, obviously you have debt service from bringing down the spending accordingly.
Right. So we net things out. That's what balance sheets do. And when you net all of this out, not claiming credit for something somebody else did or Congress and the President did before, that you can't say this budget has policy changes which achieves a result which was already achieved before. It's not achieved in this budget. With respect to war, we pass supplementals to fund wars. Congress has to affirmatively pass these supplementals to fund wars. So if there's a back door, it's already closed. If we're pulling out by some date certain, which everybody now agrees to this timeline, it's not as if it's a surprise. It's a flaw in the baseline that they assume we're going to be at a full-fledged war for 10 more years.
I think of CBO,
it doesn't work to cut us off.
I think of the CBO as the referee.
Like I'm saying, please don't interrupt.
Okay.
We pass supplementals. It's not a back door. If we're not in war, we don't pass supplementals. What I'm saying at the end of the day here is when you net this out, this budget, using your own numbers, has a net increase of spending of $1.5 trillion and a net increase of taxes of $1.9 trillion, and that is how you result with the $400 billion of deficit reduction. These are your numbers we're using. We're not using somebody else's numbers. Let me ask it a different way. How much does this budget add to the debt? What's the nominal amount of money that this budget adds to the debt?
Well, I think the right way to think about it is as debt as a percentage of GDP.
No, but what's the nominal amount? How much actual money is added to the debt?
Well, the nominal amount we can pull from one of the tables. Let me have my team gather that while I answer the question, I think, the right way, which is to think about the debt as a percentage of GDP. And this budget stabilizes debt as a percentage of GDP, which is very important for maintaining the investment environment that we all want, which is making America the right place to invest. Let me just circle back, if I may, to OCO. I think we would all agree that the CBO, is the referee here, and I just want to make it clear that CBO does score OCO as savings.
So if we assume we're going to be at war for 10 years in the baseline, because that's what the law requires CBO does, by the way. It's not CBO's fault. And all of a sudden, we're going to have a pullout from Iraq and Afghanistan before 10 years is over. This money is all of a sudden a spending cut. It's savings.
Savings relative to the baseline, according to CBO, yes. And it importantly closes the back door on discretionary spending.
If this is the way we measure reality, heaven help us. I'll just use your budget, your chart. And if you could bring up figure 1, please. Because I have your number for you, so I can just get into it if you want to. You're adding $11.4 trillion to the debt. No, excuse me. The baseline adds $11.4 trillion to the debt. That means if we just don't do anything, we just sit still, we add $11.4 trillion to the debt. Your numbers in your budget adds $11.2 trillion to the debt. So how on earth can you make a claim that this budget achieves $4 trillion in deficit reduction when your own numbers show instead of increasing the debt by 78%, it increases it by 76%?
Well, I think
instead of increasing it by 11.2 trillion, it increases it by 11 point.
I think two points.
Instead of 11.4 to 11.2.
2 points that I would make. One is I think it's really important that we're starting with an honest baseline. The idea that each year we patch SGR year over year or AMT year over year, it's just not reality. You got to start with the right baseline of where we are, and we do that. So I think it's much better we face into the wind and know where we are. Secondly, a lot of this is inherited. It's inherited from an administration that passed an 01 and 03 tax cut that was unpaid for, a Part D Medicare unpaid for, 2 wars unpaid for, and then we walked in, as Congressman Van Hollen said, to an economic situation, which was the Great Recession.
So if these wars are unpaid for, then how can you claim savings from them?
Well, they were unpaid for at the time, yeah. And therefore, we are capping the savings, capping OCO and getting the savings, and CBO scores it as savings.
I think you see my point. If this is corrected, look, we all agree the baselines are messed up around here.
Mm-hmm.
That's not a source of contention. But if the baselines are as messed up as you say, and we agree, then you can't have your cake and eat it too. You can't say that this budget is cutting the deficit by $4 trillion. If you actually add this all up, net it all out, it's a $1.5 trillion. These are your numbers. $1.5 trillion in net spending increases with a $1.9 trillion net tax increase, and that results over the 10-year window of a measly $400 billion of deficit reduction over a 10-year period. And look, I know we love to go back and bash the last administration, and lots of us have criticisms with past fiscal policy from both political parties. This is your fourth budget. I mean, it's not as if the president came in office a month ago. This is his fourth budget, 4 years of trillion-dollar deficits, a repudiation of the promise to cut the deficit in half by his last year of his first term, I just don't know how you can run away from your own numbers.
I always want to go to the bottom line. And the bottom line here is more than $4 trillion of deficit reduction.
Okay.
The bottom line here is that we get the deficit as a percent of GDP below 3%. The bottom line here is we stabilize debt as a percent of GDP. These are important milestones. Do we have more work ahead? Absolutely.
I want to wrap it down.
This budget reaches an important milestone.
I want to give Chris his time. I just want to ask one last question. You claim to want to give IPAB more tools to consider, quote, value-based benefit design changes. But you also prohibit IPAB from changing cost-sharing arrangement for beneficiaries. I don't understand this. If we're saying you can't have cost-sharing arrangement changes with beneficiaries, but IPAB now will have the power to design, quote-unquote, value-based benefit design changes, what does that mean?
You know, at the end of the day, we've put forward in this budget more than $360 billion of health care savings. What they're based on is what I've seen in the private sector. I know all of you have seen. I know there's a doc in the room, which is there's tremendous variation in how medicine is delivered around this country. And there's not a great correlation between how much it costs and how effective it is. And we need to drive to that intersection of lower cost and more effective health care by decreasing variation in care, driving towards best practices, having the same type of productivity increases that other sectors have enjoyed in health care. What does productivity mean? Productivity means you drive down costs and increase quality at the same time. So we've made progress with the Affordable Care Act. We've made progress in this budget in driving toward more productive health care, more efficient, more effective care for our seniors, and we need to continue to do that.
So we're going to give IPAB more power to determine how value is achieved on benefit designs?
IPAB is a backstop on the system. We are making sure that we're driving toward more effective, more efficient care, and that we are not in any way violating the basic compact that we have with our seniors to provide them with high-quality care.
Mr. Van Halen.